While the Health Minister has been grilled by Parliament over the viability of the National Health Insurance Bill, this after Zweli Mkhize tabled the bill before the Health Committee in Parliament. Our reporter Liz Detlinger attended the briefing and has this report.
There's concerns from opposition parties that this is just not an affordable thing to do and just a really bad time. The minister says it's now or never. He says it's never going to be a good time to implement something as ambitious as the National Health Insurance, and that if we had a healthier population and saw to the well-being of our citizens better, it would contribute to economic growth and stimulate that growth that some MPs feel first needs to happen before we can implement something of this nature. But the minister telling the committee today that ultimately they shouldn't lose sight of the fact of what this bill is intended to do, which is to give people their constitutional rights of better health access.
Let's mine down a little further, Lindsay, if we can, to those MPs themselves. What sort of concern, what sort of opposition have they been expressing?
Jeremy, a barrage of questions from opposition MPs. The Freedom Front Plus first off the mark. Took almost half an hour to get through all his questions. Most of them revolve around the affordability of such a mammoth task and also the sustainability. Also the DA raising concerns obviously about the constitutionality of the bill. Still not convinced, even though a state law advisor present in today's meeting says she's satisfied it meets all those requirements. But also concerns from the DA that pilot sites for the NHI just haven't yielded the results that would make them feel comfortable that the country is in a position to implement an NHI. And Lindy Wilson of the DA saying that she'd visited 30 clinics and the state of their services leave a lot to be desired, and really speak to how government plans to give everybody the services that they are promising through an NHI, when the reality is that the state of so many public facilities are really sorely lacking.
Just very quickly, Lindsay, if I'm not mistaken, then the bill is now out of the hands of the Health Department. What's the next immediate step then?
Yes, Jeremy, this bill is now firmly in Parliament's hands, and more specifically the Health Committee. They will have to drive this process forward. The first step that they will take following today's meeting is to draw up a schedule to take this bill around the country for public consultations in all of the provinces, public hearings where everybody will have the opportunity to give their input, voice their concerns, make their comments on this bill.